All right. Dancing Monkeys live show. I guess we're, right? Yes, that's what we're doing. So in a moment, we're going to have Darren, of course, join us. And then, of course, we're going to have Eileen join us. She is awesome. I've known her for a little while now. She seems like a pretty great individual. So I'm really, and look, here she is. Here she is. So I'm really excited to have her on. I'm going to, again, try to get her in here. Going to get Darren in first. And then we're going to get Eileen in. And then we're going to get this crazy party started. All right? So let's see. Darren's in. Darren's in. All right. Oh, I'm going to invite Eileen. All right. Whoa, there we
Hi.
go. There we go. All right. Now the party can begin.
I've been
Awesome.
sitting here for 10 minutes
Same.
because I was afraid I was gonna be late to the party.
No, it's okay. The party train has entered the station, and we're off to a great start. Darren's all pink and purple on his end. I don't know what kind
Cool
of discotheque
room.
he's in,
It's
but
it's something to foreshadow for the future. Just give it
Okay,
that.
I like it.
We'll see.
Manifest that.
Yes,
what future are we?
you will see.
Oh, okay, cool. That's all right. Whatever. Uh, for everyone joining in, so this is Eileen. She's gonna introduce herself in a moment. I'm gonna introduce myself. Darren's gonna introduce himself. But the point of this is we're gonna discuss about healthcare, what is good care, and also to just dive deeper into what is health really, and all interesting ins and outs. If anybody has questions, definitely post them into the comment section. We're going to refer back to them as we kind of finish each point. And with that being said, Eileen, tell us, who the heck are you?
Hi, everyone. I'm Eileen. I am a physical therapist turned acupuncturist. I became a PT in 2013, and I was a physical therapist for about 4 to 5 years, where I worked mostly in inpatient subacute settings and also chronic pain research in pediatrics. Sometime around the 4 year mark, I was like, I want to make a career change from where I was because I just felt like I hit the ceiling in the profession. And I wanted to just dive deeper more into the actual physical body. So I decided to go back to school for acupuncture, which was a 3.5 year program. I totally don't recommend going back to school unless you really are dedicated to changing or transitioning to something different in your life. So I decided to go back to acupuncture school, and I was there for 3.5 years. And I graduated, moved back during a pandemic to Connecticut from Boston, and I started my own practice
That's awesome. Wow, that is an awesome
Nice.
story.
in a pandemic.
You know,
Yes.
wow.
Yes.
Yeah.
Cool. All right. Well, a great start. We're going to dive a lot deeper into that in a moment. Darren, why don't you tell us a little bit about yourself?
Yeah, definitely. And I love the acupuncturist puns there as we're diving deeper into all this. I know.
Love it.
I know. Danny doesn't love my dad jokes, but hopefully
Take a
you
stab at
enjoy
it.
them
Go
more.
ahead.
Stab at it. Another one. Stab at it.
Oh my God.
Let's keep it going.
Anyways,
Let's
my
do
name
it.
is
Let's do
Darren.
it.
I'm the newly, addition to Project Physical Therapy with the lovely Danny Shapiro over here. I am originally from South Africa, but immigrated to Philadelphia, and actually, spent most of my life there. Played soccer, fell in love with movement, went to Binghamton University for my undergrad, where I majored in psychology, health and wellness, and then went to Temple University for my graduate for physical therapy. Now incorporating, movement, yoga, everything I've kind of built up into Project Physical Therapy, working with Danny, dancing, getting the dancing moves a little bit better, but just loving everyone that we meet and just, collaborating, doing things like this right now and having awesome conversations with other healthcare workers. So I'm excited for tonight's conversation.
Awesome. Awesome. Darren, you're supposed to
And
say
you.
more about yourself. More. Come on, man.
And let's hear it. Let's hear from you.
All right. Well, nothing crazy about me. Hi, everybody. For everyone who doesn't know me, my name is Danny Shapiro. I opened up Project Physical Therapy in January, 2 months before COVID hit, and well, now we're here. Before becoming a physical therapist, I was a professionally trained ballroom dancer of 15 to 16 years. Was U.S. champion when I was younger, 6th, 10th in the world when I was competing with the World Championships. Big dancing background, love movement, and that is how I bring my therapy techniques to my patients today, which is incorporating movement, because motion is lotion, movement is medicine, and that is the pillars of what really makes a difference in terms of your pain, tightness, and what really brings people back to enjoying a quality of life. So I'm a very big fan of movement. I love exercising. I love just moving the body in different ways, challenging the body, pushing the limits, making people smile, making people laugh. That is one of the biggest things that that is one of the biggest things that's really important to me. Most of the time, like the patients who know me know I'm totally cracked out. Eileen, Darren, I'm totally cracked out.
Absolutely.
Literally.
Yeah, just like a freaking crazy person. So, that's who I am. And I try, when someone comes to me in pain, like, we know that there is pain. We don't need to, like, be censored about everything about pain, right? We've got to bring everything to the lighter side of life, right? Through movement, through jokes. I got dad jokes of my own, Darren, okay?
We want to hear 'em.
I don't know if Instagram's ready. They're really bad. They're not as bad as Darren's. They're not as bad as Darren's, and they're just in the moment, in the moment, gold nuggets of really terrible dad jokes. But that is a little bit about me. So, and since we said where we went to school, I'm a U.S. citizen. I went through school here, but I decided to go to Amsterdam, and I lived there for 4 years. Going through school, very manual therapy based, very movement based, which aligns exactly with what I love to do. And while I was over there, I was also a physical therapist for a rugby team, traveling around all the Netherlands, and doing all that stuff. So I saw some pretty crazy things. People's noses over here, thumbs barely hanging off the hand, and people still wanted to play even with those injuries. They're like, just tape me up. I'm like, dude, what? Your stuff is hanging all over the place. What are you talking about?
You need to rest. For the one time you need to rest.
Yeah, just rest. Maybe go to the hospital. Get an x-ray maybe. I don't know. It looks like your nose is broken. Well, what do I know? It's over here, huh? Anyway. Eileen, very excited to dive into everything with you, and it's going to give people a really better understanding of what acupuncture is, how it can be beneficial, and how it can be used in the proper way. Right? Not all acupuncturists are made the same. Not all PTs are made the same. Not all chiros are made the same. And let's find out what makes us different. So, first things first, let's dive in. What does healthcare mean to you? Healthcare.
I cannot believe you spelled that. I don't even know if that's spelled correctly.
I don't think it is.
I wasn't counting the letters at all.
You know what? Fact check me, Darren. Fact check me.
We'll go back to the tape. It's recorded.
Okay. Yeah, we could just review it back, right? More than healthcare, it's more about what is good care. What is good care to me, in my own words and from my own mentor, is service above self. And everything that I do is always at the benefit of the patient before myself. And my patients, the ones that walk in through my door, are the ones that have the same kind of similar values that I have. Like we're creating goals, and it's not just focused around their pain, and we're creating trial plans, and we're creating treatment plans to make sure that they're living a quality of life. And I always say to them, like, it's not, I don't know if I can take away your pain 100%, but if you're moving better, you're living better, you're doing more of the things that you want either in the face of pain, or you're being able to push through it, then I'm satisfied with that goal, with that kind of achievement, if you are. And I would say like 99.9% of the time, they're happy with that.
Right, and Darren, like, this is what we talk about all the time in here. It's really patient-centered care.
Yeah.
It's not all about us as the provider. I mean, we're there for the people that come to us, right? But it's really about, okay, what do you as the patient in front of me right? What do you want to achieve? What do you hope to achieve? What have you tried that hasn't worked so far? And how can we make your experience a different one? And really, and Eileen, we spoke about this on the phone yesterday,
Yeah.
right? Like, you're not providing acupuncture, same as we're not providing physical therapy.
Right.
We're providing an experience.
Yes.
An experience of growth, an experience of change, of positivity, of feeling different, working different, functioning different.
Absolutely. It's
Right?
teaching people how to be more in tune with themselves. And I always say to them, like, you know, you're in pain and you're sitting across from me looking for some kind of solution. And it's not just me giving you a treatment, it's us trying to get to an outcome.
Yeah, I was going to add exactly that. Like, not even, as Danny said, like a service. We're going to a product. Like, we're almost taking this person through that experience to a product. Which I hate. I'd love to just throw this out, like, you know, right early in this in the show already. But let's talk about, like, even insurance, right? So even in my experience with insurance, how many times have you seen from, like, insurance companies that they don't really want to see the patient center goal? They want to see a range of motion is, you know, for knee replacements 130. Great. My patient is 130, but can't do, you know, can't, like, sit up from a toilet, can't do, like, specific things. Yeah, 130 could include, you know, somebody standing up, but there's so many different aspects to what a patient values and what they want.
Yeah, absolutely. I feel like, and I know you guys are out of network, right? Me, I don't take insurance, and it's, I think we have the same values in that, why we choose not to take insurance, because insurance dictates a big part of how we decide, or how they decide for us to treat.
Exactly. And I refuse to let someone sitting behind a desk who may or may not have any medical background dictate how many sessions you need, what kind of treatment you need, what kind of plan that you need, because that is freaking nonsense.
Yeah.
Right?
Just because their insurance gives them 12 visits, 20 visits for the annual year. Like, it's never my goal to meet it.
Of course. Yeah, that's not, we exactly. And Eileen, I'm sure you can say the same. Darren and I have seen, well, I would say 97.5% of all the patients that ever come to us have already tried multiple different therapists, multiple different chiros, multiple different doctors who all said the same stuff. You'll just have to live with it. Keep coming back twice a week for the next 60 weeks. And we're like, whoa.
Yeah, absolutely.
Whoa. Easy, tiger.
Yeah.
Something's obviously not working.
Well, you know what's even funny? Even when I first started as an entry-level PT, and just from the clinical rotations that I did in the time and the CIs that I had, the clinical instructors, if those who don't know what CI means, is that was such a common dialogue that I adopted it myself for a while. And I found myself, like, getting discouraged and burned out, and then kind of placing the blame on the patient. Like, well, they're just not motivated in wanting to do it. They're just not motivated in trying to get that range of motion. And that's when really, truly, like, being able to focus it back on value-based care really clicked for me when I did chronic pain research at Boston Children's Hospital, where we designed the study and the manuals around the kids' goals and what they valued.
Right. And that's another thing, and Darren, I'm sure you can agree with this, is that when the patient feels like they get to make the decision, or they have a voice in the treatment plan, like, it's not what the insurance says. It's what the patient wants. It's what the patient needs. It's the patient's goals. They become much more invested into the actual treatment process, where they don't drop off randomly. They are not, like, a lot of times patients are actually unmotivated because they feel like they're just going through a process that a computer printed out from the therapist side. And between
our 5 HEP exercises.
Like and then they're just being thrown around from therapist to therapist, and they're like, well, is this really doing anything for me? And most of the time it's not.
No, it's not.
But this way, patients have a voice. Patients have their needs being met, and they feel excited to come in.
Yes.
Like, that's the biggest thing. Excitement coming in through those freaking doors, coming through your doors, and that is really cool.
I want to know,
that is cool.
How many patients have walked in through your door, and when you ask, what do you want to achieve, they're like, what?
Yeah.
That's what we say all the time, and we actually give them the voice. Like I think
Yeah.
and Danny, I can relate to this and say that like for the first time, patients are actually being heard.
Yeah.
They are actually being heard for what they're feeling, what they want to achieve, what they want to get back to. And we kind of go back to it's this idea of like the 2 a.m. thoughts, right? So
Mhm.
how can you really think about something that's deeper? So for example, I saw a patient yesterday that is having, severe low back pain. And yeah, it hurts to just sit up. It hurts to, walk around at work. That is, level one, level two. But what's a little bit deeper? She's going to get married next year.
Yeah.
And as we kind of delved deeper in the conversation, she said, it really is so painful to wear heels, especially, now at a wedding. What's even deeper than that is not being able to walk down the aisle in her shoes without pain, enjoying her wedding without pain. So it's really getting deeper on those levels to understand a patient, not just, oh, it hurts to stand up, it hurts just to wear some shoes. What
Yeah.
is really deeper for those patients? And I'm sure, I mean, how do you kind of have those conversations with your patients and in your
Well,
clients?
it's really funny that you just told that case study because I had a patient come to me with severe like mid back, low back pain. And I went through my whole spiel of, okay, like, welcome, like, I'm here for you, let's set goals. It wasn't until I treated her on the second visit, she came to me and said, I gave a lot of thought about what you said, but I realized I was in so much pain. There was some information that I didn't get an opportunity to tell you about. And she's like, one of the things that think that really triggers my back pain was driving a car. And like, I have not been able to drive by myself in a really long time because I was in a really bad car accident. Um, and so far it's been her family driving her. Right.
Yeah.
And she said to me, one of my goals is to be able to drive by myself and with my kids again. And that's something I really want to achieve because the first session, it was a little bit of pulling teeth. Like, yes, this is about you. Like, what do you want to
Hmm.
get back to? And she was like, I just want to be able to like sit comfortably. But I love it when the pain lessens, like the threshold gets raised for them. And they start to wake up and realize like, wow, there's a lot of things that I'm not doing and this is important to me.
Yeah. And that's huge.
Yeah.
My God, that's huge.
Yeah,
Oh,
absolutely.
I feel like we can talk about these kinds of stories all day because I mean this is literally the kind of experience that we try to provide for our patients. It's again a place where they can be heard and a place where their needs and really their true desires, not just pain reduction, getting stronger, whatever, but which is important too, of course, but like being able to drive on my own and like being able to drive with my kids, being able to walk down the aisle, being able to run after my kids and on the playground and like actually engage with them instead of having to feel like you kind of take like a third row back seat in the minivan approach to life.
Yeah,
Right? This
these are
puts you
these are
into the driver's seat.
value-based goals for them.
Yeah,
Hmm.
And I think that if we take that kind of approach into care, to me, that's what good care is that it's
exactly.
patient-centered, it's value-based, it's helping them brainstorm because I know it's tough. When you're in so much pain, you can't think about, oh, there's so many things I can't do. I feel paralyzed, right?
Yeah.
So we're there as the providers being able to break it down for them. Okay, like how's your work life? How's doing housekeeping? How's
Hmm.
driving? How's running? How's exercise? Are you doing any of those
Hmm.
things? And then they start to realize like, wow, there's lots of little things that I'm not doing. So then I tell them, let's prioritize one or two of those things and see where we go from there.
Definitely. And even
Yeah.
comes back down to simple things like breathing. How many of your patients do you find
Yeah,
don't even, breathe, as we say, kind of like chest breathers, like we inside our sympathetic nervous system. We just had an event that we brought somebody in. They talked about regulating your nervous system,
right,
and even just like from the first session, just even talking about breathing patterns and like really getting somebody to breathe in a more optimal fashion. So
right.
there's
Yeah.
so much we can do. I want to know just more about, just kind of like the service of like, like a physical therapist turned acupuncturist and kind of, I guess like your process and what you kind of learned and like how how that's kind of like all shifted in your service. I'm really
Okay.
interested.
And Eileen, and before you tell us about that, I just want to make sure that everyone
Yeah.
who's watching, who's heard what we've been talking about so far, if you're currently going to a healthcare provider, it doesn't matter if if it's a PT, it doesn't matter if it's a chiro, acupuncturist, or even just a regular PCP, general practitioner, doctor, if you're not receiving this kind of attention, this kind of care, this kind of like if you're not being the center of attention, then as I'm sure many of the people who follow me for a while now have heard before, find a different provider. You need a provider that
Absolutely.
listens to you and treats you for who you are as the individual that you are. So seriously, if you are not being treated the way we're talking about, the way you should be treated, find a different provider. And that's really, really important to have the courage to do that and to have to know that window shopping for a provider is okay and should be done if you feel like it needs to be done. Even if you initially thought that it's a good fit, it's a good vibe, but then 5, 6 sessions down the line, you're still not seeing that relief. That's also another good opportunity to find a different provider. And
Yeah.
you need to have the courage to do that because, again, you need to put yourself first because you are number one. And with that, Eileen, go ahead.
That was so powerful. I forgot what Darren was saying.
I know. I was still
Yeah,
taking
repeat that question.
too.
Repeat it, man.
I feel like I was in a sermon.
No, but definitely, yeah, I definitely agree with that. And it's just like same thing. It's going back to product or service. If you're not happy with your product and service, send that food back. Send your Apple Watch back. Send it back. Like you are a person that is, you're autonomous. So you should be able to understand, your what you want and move somewhere else if you're not getting it. But my question was,
I say to my patients, I tell them, like, if you are not satisfied with where we're going, like, let me know. Like, I want to have that conversation. I don't take it to heart. And sometimes, like, people just need to graduate from us. I have, like, no
yeah,
problem with that. Some people feel like, she's too expensive, or, like, this is not my style. And I'm like, shop around, do it.
yeah,
Like,
yeah.
I'm totally okay with that. There's enough people for everybody. There's enough pain to go around.
Yeah, there's so many people around, and we even
Unfortunately.
say, like, yeah, go out and go experience what's
Yeah,
out there, right? That's
right.
definitely fine. We're not the only service. And that being
Yeah,
said, physical therapist turned out acupuncturist is a different service there.
yes.
Let's kind of run me
And
through
it's a
that because
really
I'm
cool
very
combination.
interested. Yeah.
So, what are you asking? Like, are you asking how I decided to transition to that, or?
I
How
think
are
my
you so
original
cool?
question,
Huh?
no, definitely I think my original question was just like the way you provide being an acupuncturist now with the PT background.
Oh, well, I'll never
How,
stop being a PT. That's the funny thing. Like,
yeah,
I can't help it. That's like my base, my foundation. Um, I don't know if you guys ever did cadaver lab or gross anatomy, but back in my day, because I'm an old timer here, we had to do cadaver labs. So I'm a very kinesthetic learner and visual
Nice.
learner. So for me, like, human anatomy was one of my favorite classes. It was the toughest, but one of my favorite classes. So learning the anatomy of the body, and also you have to learn the physiology of how everything works, right? Or just get a general gist of it. Um, so when I became an acupuncturist, I actually had a really tough time in acupuncture school trying to understand the very, I don't want to say archaic language, but classical text language. And my mom once said to me, "Oh, it's almost better if you didn't become a PT, or like if you didn't have a PT background with that Western science knowledge, because then you'll be able to accept a lot of things more." And my first year was the toughest, but then I realized I'm a lifelong learner, so I was constantly trying to find the bridge between East and West, right? For lack of better words. Like, okay, this is what the Chinese say, but how can I turn that into Western medical terminology? Because when I understand it from that language, I have an easier time capturing what it says in the classical text. So my first year was the hardest, and then sometime around when I graduated and I took a bunch of what we call medical-based acupuncture. There's lots of different styles of acupuncture, just like lots of different specialties in PT. That's when I realized, like, oh, we're really speaking the same language, just in a different way.
Yeah.
So I took a lot of time trying to find the right words to learn it, and also find the right practitioners that I felt were more geared towards the PT background of how I perceived, medicine. So I guess that kind of goes into how I look at what is acupuncture. And because, like, let me ask you a question. What do you guys think of acupuncture when you first hear that word?
Okay.
Well, I mean, so it's funny. My dad's actually an acupuncturist as well.
Oh,
We,
stop. Okay, you don't
I
count.
didn't tell you that yesterday. So
You didn't tell me that,
like,
eh?
I have a very good surprise. Can't tell you everything, okay? No, so my dad's a podiatrist and an acupuncturist. Like he also went through 3 years of school
Wow.
and
Okay.
like is an actual acupuncturist. Like I've had acupuncture from as young as I can remember, like through my dancing days. I remember needles in my head, in my hands, like all over the place.
Yeah.
So I'm like very cognizant of. Before I just thought it was some magical thing, like some
Yes.
magical energy flower thing. But again,
Right.
as we discussed yesterday, we went on like again we had a sneak peek conversation about this.
Yeah.
Everybody on the phone yesterday. Like now as a physical therapist, I look at acupuncture differently. And before I say what I say, Darren, you go first.
Yeah. What do
Oh
you
wow, that
think?
was a so I also have a little bit of experience with acupuncture. Especially I did some rotations in South Carolina where, as we say, dry needling, as we say, because it's right, and this is like a whole conversation as we can kind of open up.
Yeah,
That
we
physical
definitely can.
therapists, yeah, can dry needle. In essence, to be honest, I couldn't tell you, the difference between acupuncturists and dry needling, and that's why some states physical therapists can dry needle
Yeah.
because of those like laws. So in South Carolina, I was able to kind of witness that with a physical therapist. I've also had it done on myself. I actually have like TMJ, some jaw problems.
Mhm.
I've had it done in my face, things like that. But I think it's an incredible, as you say, service that depending on the patient and their goals, if it's warranted, it can be really useful to decrease pain, restore function, and get somebody back to, whatever they need
And
to do.
that's exactly how a PT would think clinically, like through their going through their flow chart, their like clinical tree. You could see
Hmm.
15 patients in the day, and then you think, could they benefit from dry needling? Could they benefit?
Yeah.
And to me, nowadays, I'm like, everyone could benefit from acupuncture, right?
Yeah.
So that's where like our lens is a little different. So for our viewers, I'll explain a little bit about how I look at acupuncture. So acupuncture began about 2000 plus years ago, probably even earlier than that. And there had been a lot of different interpretations about the medicine. And when you hear the words like chi and properly pronounced as tea or meridians, you think energy and like this non tangible phenomena that happens, right? And actually, all that language really came from a mistranslation, which is crazy because that's what I learned in school, right? As a foundation, or a lot of the acupuncture professors that I've spoken to, I found it really hard to find the right, because I'm so Western based that I'm like, I want to find the right terminology so that when I have patients, especially in the US, that they understand what I'm saying, right? So what it really came down to was a mistranslation of what the medicine really was in the 1930s, 1940s by the French. And then it trickled down to the West, so the US and Europe and all over. But I believe, and in the text, that the original, I say, kind of like the original physical therapists, they actually discovered the anatomy and the physiology of the body, but didn't even realize that they did. It's just like one word in like tea in Chinese medicine has multitude of meanings, and it's so hard to just translate tea as just energy because I speak Mandarin Chinese. So when I hear it, I'm like, but that has so many different radical attachments to it. It doesn't mean just one thing. So that's part of it. But fundamentally, I look at acupuncture as a physical medicine. So again, so it's going back to the anatomy and the physiology of someone's body, and it's the skeleton, the bones, right? It's the muscles, it's the organs, and it's all about in Chinese medicine the structure and the function of the body. And how does acupuncture work? Acupuncture, in the simplest of terms, works in two ways. One, it improves the blood circulation in your body. And then two, it helps regulate your nervous system. So that is a general gist and very, very brief history of how what is acupuncture, where it came from, how it got mistranslated, and how it works. And also, just to briefly translate what in a physical sense tea is not something that's non-tangible. It's not energy medicine. Tea to me is nutrients, it's oxygen, it's painkillers like the enkephalins and the endorphins, right? It's the immune cells that are in our body. And the meridians, the channels in Chinese medicine are really blood vessels. And all the tea, the nutrients, blood vessels, or tea, the nutrients, the oxygen, all that fun stuff gets carried through the blood vessels. And nerves run with the blood vessels.
So laid that bomb on us,
that
huh?
is the simplest of terms, and that is very not well known.
Wow.
Yeah.
It took
I
me
mean,
3.5 years plus to not to figure that out, but to find the right ways to say it.
and we just found out in 10 minutes, huh? Look at that, huh? Look at that.
No, but it's interesting. As you said, we always
that's
think it's kind of the energy flow, and we always think, okay, you know, like I'm not so much about that. And if, for people that aren't into that, but as you said, let's put it into, you know, words that we can, you know, all understand in, you know, modern day
Well, I
times.
think for healthcare professionals, this is something that's, you know, very crucial to understand, because I've met tons of healthcare professionals. They're like, oh yeah, like you guys are really into like the energy and the tea. And I'm like, no. Let me reintroduce what acupuncture really is, because it's tangible. You can touch it, you can feel it, you can see it. It has an inflammation response every time you put in a needle, purposeful one, right? It sends messages to your brain. So for me, that is the approach that I try to explain to my patients and to professionals. And they understand that, right? Like Chinese people, they understand that to have good health, you need to have good blood circulation. If you do not have good blood circulation, you bruise easy, you know, stuff like that. You get tired, fatigue, your muscles feel weak. That usually is or you have lots of pain. That's usually an indication of what we call blood stagnation. And blood stagnation, where blood is stuck, there is pain. Where there is pain, blood is stuck. That is as the meats and potatoes of Chinese medicine.
And you know, like that is absolutely true. And there's so many things out there right now, like all these massage guns. And I mean, I don't even want to talk about foam rolling because that is
I'm okay with
keep it
foam
together.
rolling, but yeah,
Keep it
you know
together.
what? Maybe that's another conversation we need to have.
Oh my God. Darren, burn it. Burn it, Darren.
It was free.
No, but like, but
He
all
like
these
ends
things
the
are
live.
yeah, and we're done. Uh, but all these things are trying to kind of accomplish the same goal. Although massage guns, like people, my patients always ask me, like, oh, should I get a massage gun? Or if I have a massage gun, should I use it? And I'm like, well, look, I mean, if you weren't in pain, then sure, right? Like
Right.
massage guns work on a very superficial level to provide vibration to the tissue and kind of to like remove surface level tension to help more blood flow circulate the area. And again, you tap enough times, I mean, this brings attention within the body, like the brain focuses on this area, and you know, if there's an issue there, like the blood will start to go circulate into that area again when there's attention brought to it. So acupuncture is actually really cool because it forcefully brings attention
Absolutely.
to the areas that need to be like unlocked or unblocked.
Well,
Right? Which is really, really
over
cool.
300 acupuncture points, right? I know that sounds so crazy,
Yeah.
but the Chinese, they found out that like every single one of those points, it's concentrated with nerve nodules and arterioles and venules, right? That's what really an acupuncture point is. Now, like the point on the leg treats the intestines. Yeah, it absolutely can, right? Especially if that nerve runs back to the spinal cord and then, you know, sends a message back on the same level to the intestines, it can treat it. But that's honestly how I explain it to people when they don't have the kind of knowledge that we have in terms of anatomy and physiology. Yeah, we could dive deeper into that one day, but
Yeah, referred pain. That's sort of the whole thing. Like
absolutely.
you talk about neck, like, okay, why do I have sensations in my, tingling or numbness into my hands?
Yeah,
Is a carpal tunnel? Okay, I've been diagnosed with carpal tunnel for years. I had the release, nothing's working. What
right.
about my neck?
Yeah.
Mm-hmm.
You're
Yeah.
always trying to
Mm-hmm.
find the root issue of what's
Hmm.
going on. So that's actually, I don't know, I'm sure that's how you guys treat, that's how we treat. I don't know if you guys call it, but we tend to say, don't just treat the branches of a tree, but treat the trunk, treat
Well,
the
like
root
that.
Mm-hmm.
issue, right?
Like that.
Yeah.
Because you want the branches to stay healthy. You can remove leaves or whatever, and pain will stay at bay for some time. But if you don't try to water the trunk, you don't nourish it, the branches will
Hmm.
fall off, break off, or not be as healthy.
Well, exactly. Exactly. And I mean, that's kind of in a way how we phrase it, right? We always talk about the root cause of the problem. And, I like to mention to my patients that pain is not the problem. Pain is a symptom, right? Pain is a
Yeah.
phantom apparition of, like, you know, the the actual problem, right? It's a haunting of the body, right? But once we find out what's causing that haunting, what's causing that symptom,
Right.
which is pain, and once you take care of the root cause, then the pain's gone. And where the pain is, it doesn't always mean that that's where the pain is,
Well,
right?
pain
That's not
is
where it's coming
healthy.
from.
Would you agree? Like pain is healthy for us. Like it gives us a signal to let us know, like, hey,
Yes.
there's something wrong, right? Like acutely, right? Like, oh,
Hmm.
that, like rolled my ankle. That didn't feel good, right?
Hmm.
That's my
Right.
response, but I don't know
Well,
about
of
other
Our
course.
people. It's
but
a
our pain
signal.
system, yeah, go
Yeah.
ahead. I say our
Sorry.
pain system could be out of whack, right? Talk about chronic pain now. There's the video Tame the Beast. I don't know if
Yes.
you're familiar with it. It's one of the most utilized physical therapist videos. It's about our pain systems. So people that have had pain for like 50, 30, 50 years, and they're getting pain from like just simple movements, simple stimuli, simple things that they're doing in their life. What's going on? Is their pain system out of whack? Pain is good, but like also what's going on?
Well, they always say like, oh, it's all in your head.
Yeah,
And I
Oh
almost
my
hate
God.
that saying because
yeah,
I feel like
yeah.
it's been said in such like a condescending way.
I
But
know.
at a very factual level, a
It
good
is.
proportion of it is in the
Yeah.
head.
Yeah. Yeah. It's a mind body connection, right? And that's the thing. It's not when people just give up with the body and they were like, okay, it's just in your head, but they don't look at the connection between them. They're kind of
Yeah.
just dissociating between them.
I mean, I see a lot
Yeah.
of patients
And
with
oh my
chronic
God,
pain.
that's exactly. And again, a lot of those people are told that the pain is in their head, but in the condescending way, right? Like pain is not actually explained. Okay, like why are you experiencing this pain? What could it be actually coming from? And if like we are saying pain is from the head, it's as like a fun fact. Hey, did you know that pain actually registers in your head? Right? Like it's coming
Right.
from that
Right.
angle, and
Hmm.
not saying, oh, it's just like you're just gonna have to deal with it. Get over it, go do something, and
Right.
then people are just kind of stuck with this pain for a long period of time. And
Yeah. Take
chronic
some
pain is
meds.
mostly the kind of people that we see.
Right. Yeah.
Yeah,
I see a ton of chronic pain patients. I've been so out of the loop as a PT and nowadays how you guys tend to battle. I know it's movement is medicine. I'm curious to hear more about how you guys approach patients nowadays in the clinic.
Def,
Yeah. What
definitely not
about
with a
the
foam roller.
question? What about the question in the chat? So there's been two frozen shoulder questions. Do you want to tackle it from maybe like Danny with the PT side, and then have you kind of do it from the acupuncture side?
I mean, yeah. You know what, Eileen, you're the guest. Why don't you go first?
Oh my gosh,
Ladies
thank you
first, and
so
then I'll
much.
go. Oh, you got it. Let's go. Let's hear it. Let's hear the explanation.
Frozen shoulder is extremely complicated. It's not a true musculoskeletal issue. It's very systemic, systemically based. Uh, and it depends on what stage you are at in your frozen shoulder. If you are a complete frozen shoulder, that's going to be a lot of aggressive physical therapy, manual therapy, and I know it's extremely painful. So from an acupuncturist point of view, it's probably one of the toughest to treat, but you can treat it in terms of pain and to help improve the inflammation that's in the area. What about you, Danny?
So mine is actually going to be a little bit of contrast to that. And so I love treating frozen shoulder. Oh my God, I love it. It's
Tell me
so
more.
much fun. Oh my God, it's so much fun. I'm just sitting here teeming with excitement. Like, oh my God, I can't wait to speak. Um, I have worked with frozen people who had frozen shoulder, and just to give a very broad explanation of frozen shoulder, like Eileen said, there's no specific way of how frozen shoulder comes about. It can come from trauma, but it can also come not from trauma. And to like there are different stages. There's like the freezing, frozen, and then like thawing stage, right? And I've treated people in every single stage of the frozen shoulder, and multiple people within all three phases of the frozen shoulder. And and let me tell you, oh my gosh. I was working with a woman who literally could barely get to 90 degrees. She stopped. I don't know if you guys can see me. She stopped literally right about here, and she's been stuck with that for I think like 10 or 11 months. Right? It's like nope, that's it. Can't go anymore. If she wanted to go higher, well, then we got to do this and compensate with a side lean
Right.
and reach for something higher. Could not reach past that point. And she's tried everything. She's tried the shots. She's tried the chiropractic. She's tried the therapy. Nothing. Within 40 minutes, whoa, going crazy. All
Was it
right?
the foam roller?
Yeah, I was just beating her shoulder. Hey, how about now? Is it better now? How about yeah. Uh,
What was your
you know, but
secret?
my secret. No. So my uh, whether you're looking at frozen shoulder or let's say someone can't get full range of motion at the hip, like someone can't lift the knee up as high as they want, they feel something stuck. If something is stuck, that means there's something not quite functioning. Now, it could be calcification of the joint, it could be some kind of muscle decompression, some dysfunction. It could be a number of different things. However, a combination between facilitation of the movement. So what I personally love to do is I love to grab the shoulder blade and provide targeted pressure around the shoulder blade, depending on where I think what the actual issue is stopping the movement, and then facilitate that movement and see how much I can naturally help to increase that range of motion. That's number one. Number two, I also actually, Eileen, I don't know if you know that, I didn't tell you yesterday, but I actually created my own therapy technique that is trademarked. It's called Myomel Therapy, and it is actually a type of myofascial trigger point release therapy that helps to literally melt away. Like I called it myomelt because it literally melts away the muscle and releases the range of motion. And that is also a very big part of how I was able to drop all these
Ah.
issues with frozen shoulder. Again, at all, like completely frozen, thawing, freezing, all of it gone, literally within that session. And she came to me back the next one. She still retained all full range of motion. And this is, again, coming from someone who could not move their shoulder whatsoever. It was completely, totally blocked, hitting the wall with in terms of range of movement. And I love it because people are like, what the actual beep? And again, these are people who have been to the top doctors, top injectors, top surgeons, top this, top that. And here's some guy in Brooklyn, in Brighton Beach, in some Russian crazy area, cracked out of his mind, being able to kind of like look at it as a bigger picture, not just what we see in the textbook of, oh, okay, well, I guess we got to wait 9 more months.
Yeah.
Mm-hmm.
9 more months till the thing sees its shadow, right? And then
Yeah.
we go
The
from
way I
there.
treat it, it's pretty aggressive, like the manual work, and then I actually don't needle into the shoulder all the time in the beginning. I needle distally, so like into arms and legs, and that can also improve their range of motion. But there's certain
Cool.
lag times where I didn't have the Myomel, so but I think I would have
Hey.
made all the better gains, obviously. So obviously, if you have frozen shoulder, you need to see Danny Shapiro for that.
Let's go. Fix your frozen shoulder in a jiff. Yeah, but that's a personal favorite of mine, and I personally love the shoulder joint as a whole because it is so freaking cool. No other joint can do what the shoulder does. It has the most range of motion, the most mobility, and it's like what? And it's a floating joint. It's floating in space. What?
Can you
The
name all
body's
the 12
nuts.
muscles that attach to the scapula?
Yeah, let's hear it.
Yeah, let's hear it, Danny.
Well, Eileen, since you
Put
brought
them
it
on
up,
there.
go for it,
Well,
huh?
you
Go
just
for
love
it.
it so much, so.
The only thing else I
Why?
would add, so
Why
while
you
you're thinking
starting
about
shit,
the
huh?
muscles, while you're thinking about your muscles, the only thing I would add with the shoulder, and talk about the neck, right? We're talking about
One,
referred.
two.
I can't with him.
I love it.
Go, Darren, go. Come on.
No, but just like either referred pain, the neck shoulder connection. So even with road and shoulder, like treating the neck, right? I'm coming from like a manual base. Like I also look at the joint too. So I'm very much like treating the neck can also help. So same thing you acupuncture different parts of the body, it can help restore range of motion. It's going back now to test retesting, right? Is our interventions, is our services having a positive outcome, which
Right.
is leading towards their patient goals, all right? We can have them,
Yeah.
having the, like I said, go back to range of motion, 120 range of motion for, bringing your arm up. What does that mean to them in their goals? And it's really coming back to now, patient-centered care.
Love it.
So,
And you know what?
yeah.
I could think of like one or two cases that I'm like, you know what? This is where my limitations are. And
Yeah.
I've heard them out. And I'm like, that's so important. It's you gotta kill the ego. I'm very big on that.
Yeah.
100%. Yeah, that's
Yeah.
why we collaborate and work with each other.
And now I know to send all my frozen shoulder people to you.
Let's do it. Let's unfreeze those shoulders.
So what are
Let's
the
get
12
shit moving and
muscles,
grooving.
Danny?
Yeah, you had enough time. What are the 12
Why
muscles?
what did you say? Hold on. All the muscles that go from the shoulder blade to what?
All was it 12 or 17? I can't remember. I think it was
Wait,
17
what was the
muscles that
actual
attached to the
question?
scapula.
That attached to the scapula in particular.
There's a lot.
Yes, there are.
Well, I mean, okay, we got our traps, we got our rhomboids, we got our
Uh-huh.
levator, we got our teres minor and major. We got. Are you counting, by the way?
Yes, we're counting.
All right. Supraspinatus, infraspinatus.
I'm at 9.
Let's see. Huh?
I'm at 9.
Serratus.
Yeah.
Let's see. Pec minor.
Uh-huh.
I mean, are we counting the rhomboids as 2? Right, minor and major?
1.
Yeah.
Are we counting that as 1?
But we'll count it. We'll count it last.
Ooh, lats. There you go.
Ava, well,
Nice
lats
job.
don't go to the. Well, I mean, I guess they kind of do.
Kinda do.
Yeah, kind of do. Which one am I missing? So for
There's
Darren,
one in
cover
the
me.
throat.
Did you say subscap?
Oh, you forget to say
Yes, good
that.
one. Yep, subscap.
My favorite.
One in the throat.
That's a great acupuncturist one.
Which one are you thinking about?
Subclavius? No.
No, I think it's the hyoid, omohyoid, or one of them. Yeah.
Oh wait, yeah.
Remember? You always forget that one.
Damn, omohyoid.
Not to put
Did we
you on
cover
the
them
spot
all?
on live.
Hey, whatever. All right, it's past clinical hours. I'm hanging out with my friend. Oh, by the way, for everybody, I'm an actual certified crazy person. I'm hanging out with Michael Scott, of course, here in the back. We got Bob, Frank
Nice.
the Muscle Man, Michaela, Michelle. It's a great time. It's a party in here.
I love it.
Yeah, crazy. Hey, you know what? Let's test you, Eileen, okay?
Oh gosh. Hey.
Yeah?
I'm done
Huh?
with PT. I'm out.
Well, hold on a second. Hold on, Darren, did you have, because I know how I can test Eileen here, and of course test you at the same time, but we'll get to that in a second. Darren, do you have any questions for Eileen here? Or actually, you know what? Also, not only Darren, but anybody who's watching, any questions whatsoever so far? But Darren, you go first.
We had a couple. No, you hit a bunch of them. I think that we're, as we kind of touched on the great points, like as we said, patient-centered care, our services that we provide. As long as we're our patient.
Is it me or did Darren cut out?
He muted.
Okay, I got cut out. But I'm saying what you do sounds incredible, and like I said, I'd love to obviously learn more and see where as you said.
I got one for you, Eileen.
Oh,
This is
God.
not a test. This is just a question and we're gonna answer this question too, Darren. So you get ready. So what is how do I want to phrase this? What is a conflicting idea that you have within your own field? Like, what do you feel is wrong within your field? There we go. I mean, maybe that's a better way to phrase it.
Ooh, the tea is hot.
It's boiling.
Wow.
What
I
do I
thought
It's
we're
think?
boiling.
I thought we were
What do I
cooling it
think
down.
is wrong in my field? I think
Like,
we touched base
what is
on.
the change?
Sorry?
What is the change that you want to see in your field?
The change that I want to see in my field. The change that I want to see in my field is confidence. Um, every single classmate of mine in acupuncture school, over the 3 to 3.5 years we were together, are terrific needlers, you know? But I think that the profession lacks confidence and a little bit of its own credibility. And I say that because I'm a PT, so people automatically give me the credibility, you know, the swag. But like I paid my dues, but for them, they don't feel as accepted into the Western medical model. And it kind of goes back to, again, the language. Like there's a language problem. There's a different kind of understanding. Listen, like I don't think everyone wants to practice acupuncture the way that I do. Some are more, what I say, energy based, Reiki, you know, like when I went to acupuncture school, there was a mix of like the science nerds, like the hippies. It was just a mix, and that's okay. But acupuncture as a profession has so much validity and so much to offer, um, more than what doctors give to their patients, like painkillers, opioids.
Hmm.
A natural way of allowing your body to heal itself. Like that's what we as PTs do. We teach people how to move out of dysfunction and move better, have a better quality of life. So where I think that we are weak as a profession is the confidence. And if the school curriculums, which is, you know, it's hard to change that, adopted more of a physical medicine aspect of what acupuncture is, I think the debate between acupuncture and needling would be a little more valid. And it's not about who owns the needle, because it always goes back to the patient, right? It's more than just
Yeah,
ego.
that's awesome.
Great answer.
Yeah, that was
That's
that was a
awesome.
deep question. I didn't even know that was coming.
No, that's exactly why I ask it
But
because
that's
it's
honestly that's my
yeah.
honest answer when it comes to where I see myself as an acupuncturist, because I have a lot of pride in that. But I really sit it down when I have a patient in front of me,
Mm.
because again, everything that I do is at the benefit of my patient. Um, and I always, when I was in school, when I was learning, people were like, "This material is so hard. It's so it's true. It's very difficult to decipher." And I think to myself, everything that you learn is going to benefit your patient at some point. So just instead of studying hard for A's and B's, look at it that way. Like
Hmm.
this little tidbit of information that seems hard to conceptualize, you may have a patient that's like that one day. So
Yeah.
yeah, and you know,
Yeah.
like PTs, we have, PTs. Like I say, a good majority of us are Type A. They Something phenomenal. I think PT, the profession, does is drive evidence-based medicine, and like
Hmm.
they drive research, and I think that's why dry needling got to escalate the way it did. And acupuncture is a little bit behind, but if you go to China or France, you will see that there's tons of research, but it's not as widely adopted here in the US. That's already out there.
Yeah.
And I'm sure with time that will change,
I hope
or
so.
at least I hope it
Yeah,
does.
I hope so.
Yeah.
I'm so glad you asked that question. I hope people who are acupuncturists get to see this video and understand that they are very powerful in what they
Hmm.
do. Maybe that means having to leave some of the language behind, and admitting that, hey, like the translations weren't perfect. Maybe it's time to find ways to help people understand what we do.
Yeah. And how are we doing
Absolutely.
it nowadays? It's, as you said, what we're doing right now, we're on social media. And Dan and I were just talking about this today, but it's a constant battle. It's a constant every single day. Like we're out there, we're advocating for our professions to
Right.
show that we can actually help. We're unfortunately healthcare has failed many, many, many people.
So many.
Um, and we're really out here to educate and to really show, what we can do.
and I know this is going to be controversial, but like, it's like I said to you on the phone yesterday. I was like, should I mention this? But I don't think it's not so much about who owns the needle. It's that who does it very well, has gotten the hours, gotten the practice, and has gotten the experience, knows the anatomy, knows the physiology, and the purpose of why they are needling somebody.
Mm-hmm.
Just like PT, the corrective exercises that you give them, especially that you guys are out of network, they're going to be more innovative, more specific. It's not going to be a PT mill. I already know that. It's going to be individualized care. It's going to make someone get better faster, right? That's the mindset that I hope all healthcare professionals get to adopt one day.
Mm-hmm.
But it requires all of us to put our egos aside and also be able to say like, hey, it's okay to change your mind and like admit that you were wrong about what you thought was the right way.
Yeah.
Yeah. And I would say that's the biggest thing in our profession too. It's the value that all PTs think we're, worth more, but we don't fight for it. We don't advocate for it enough. And then reimbursements for insurance. And it's a whole cycle.
Yeah.
And that's, and the people are unmotivated because they're not getting, what they think they deserve.
Yeah.
So it's a whole cycle.
People deserve a lot and they don't know that. And I'm so glad that, I wasn't someone that wanted to be on social media. I remember I was like messaging him like, should I be posting? And the more that I do it, like the easier it gets, obviously.
Yeah.
This is just a FaceTime with like 25K of your followers, but that's fine.
It's no big deal. All right. It's fine. Everything's fine. Just conversation.
Yeah, no, it's fine. No, I love it. I love having these conversations. Like this is such a more global outreach for people than just the three of us just having a conversation, just shooting it, like I love it.
Yeah. And conversations is how the ball gets rolling and how the ball gets moving.
Yeah.
And Darren, like, I know you recently joined my team, but what's something that you want to see a change within the PT world? And then I'm also going to tell you, well, I mean, Darren, you know what I think, but Darren, tell everybody what you think needs to change.
Yeah, I think I kind of hit on it, but it's just the value, right? I said every single day we're advocating, we're showing what physical therapy can do. Like, as I said, I'm literally wearing a Supreme physical therapy t-shirt to show just the value. There's so many conversations that I have with like even my friends, people like my loved ones that have no idea what I do.
Yeah.
And then they go through, like an orthopedist or somebody else, they're recommending surgery for something that they didn't think about physical therapy. They didn't even know that could even, fix that. Concussions. There's so much that we can actually, treat without having to go under the knife, go through, medications, have injections, things like that. That is just a every single day thing that I wish physical therapy as a whole can really advocate more for. As I said, we need to value ourselves more, and we need to do that with more, advocation.
Yeah, absolutely.
Absolutely.
What about you, D?
So much.
Let's
But
hear
one
it.
of the things that I think is really, really important, and in a way I can't really, and of course this is not all PTs, of course, and a lot of the situations that I'm talking about is more of a systemic issue of within the PT realm, of between the insurance, between people who work in a hospital or in a large practice run by some manager up top who doesn't really care and only cares about the bottom line, bottom dollar.
Mm-hmm.
But one of the things that I absolutely hate is in the box thinking. I can't stand it. I was telling Darren a story today. I was working with a patient and I saw her for the first time and she came to, she's like, oh, I got this hip pain. It's on both sides. I got some like pain going down the leg into the knee. And this PT that she was going to was like the PT to go to. And he told her that the hip is just forward rotated and that's where her pain is coming from. I'm like, what? And he was like, you just kind of got to deal with it. And like, okay, come see me as often as you can. Like, there's no concrete plan. It's just, that was a diagnosis out of nowhere. And like that had nothing to do with the actual problem. That was like nothing to do with it. We literally looked at other things around the knee, and around the hip and around the back, not just focused on, okay, here's the pain, kind of what I mentioned before where pain is a symptom, right? It's not where the actual problem is.
Right.
And I don't care how many years of experience you got, whether it's 1, 10, or 20, if you get stuck in your own cycle of thinking with things that are not really even it, whether it's because of laziness, whether it's because of you just know best and you've seen hip pain 1,000 times and this is just what you think it is. But in the box thinking is the worst thing a patient can get, because that blocks off your success.
It's like the post
Right?
I wrote, like getting complacent, like, you know,
Yeah.
thousands of shoulders that you've seen, the thousands of hips that you've seen. And then like, yeah, but it's attached to somebody. It's somebody who, you know, whatever they're going through, it's different.
Right. And there's more than just a hip. Like if the hip is rotated forward, right? Like, okay, what could it be? Tight glutes, tight hip flexors, dysfunctional abductors. Like your adductors are pulling in too tight because of the way you stand. And like even basic anatomy, a man versus a woman. Like why is a woman more likely to be knock-kneed versus a man who's more likely to be bow-legged? We also got to look at that. Like just going down to the actual anatomy on top of the other layers, on top of the individual, on top of, okay, maybe clamshells is not the best damn thing to do right now because that's not going to freaking help. Maybe we've got to look at maybe some internal, external rotation, right? Maybe, okay, I got to calm down. I got to calm down. But like, this is something it frustrates me to no end, because the people that come to me are so freaking fed up with their pain, have tried so many things, and I'm like, hey, so like, let me show you this move. Have you ever done it before? They're like, what the hell is this? I've never seen this ever anywhere at all. And I'm like, oh my God. Ah!
Yeah, it clicks for them.
Yeah, I'm off
so, but like, how do you even propose that change, that like get out of the box?
So this is the thing. It's PTs need to look at more of the individual, right? With the insurance, like, okay, someone comes in with hip pain. Well, all right, we're logging hip pain on the thing. We're not really looking at the knee that much. We're doing basic general, knee extension, knee flexion. Again, your basic general cookie cutter nonsense. This is why I said like clamshells has been in every damn hip rehab program there ever was, even though it doesn't make sense. Glute bridges are not always beneficial. And most of the time when patient is reading a paper handout, which is, by the way, in our office, there's no paper whatsoever. If we're sending like a home exercise program, everything is video-based, video form, explaining how to do everything. I cannot stand these damn paper sheets. No. Everybody, bring your paper sheets. We'll burn it on the bonfire on the roof of the building.
We save the trees.
My God. But it's like, glute bridges, why do you do glute bridges? For what reason? And if you're doing it, are you doing it properly? Are you doing it, are you watching your knees? Are you watching the positioning? Are you getting the pelvic tilt in? What exactly is going on? Is there attention to detail? Or are we just in the box going through the motion?
Right.
Yeah,
3x10 clamshells, 3x10 this, 3x10
3x10s. I mean,
hot pack. Yeah, I'm over it.
Yeah.
Everyone's
Look,
I'm saying, everyone listening, like, how many times are you just told 3 times 10?
Yeah.
That's it.
Yeah.
Not everything's 3 times 10.
Yeah. And look, like, if clamshells are needed, I'm not saying clamshells are bad exercise. If clamshells are in fact needed because we need to work on external rotation, your external rotators are not doing the work that they need to do, that's a different story. But if we're just given, okay, hip pain, great. Here are the 5 exercises that you need to do for the next 6 weeks without progression. No.
Yeah, that's terrible care.
You knock that shit out of the park and say, not for me.
Yeah.
Right, and then you go find another PT.
Yep, you find another PT.
Wow, this is a very big rant.
No, I
very
loved
aggressive.
It was awesome.
I've been kind of like not checked out as a PT. I'm still with you guys, but I'm in this other world now, So I like to hear like what's happening in the profession, even though I didn't renew my APTA membership.
Uh-oh.
I'm not there anymore.
No, I know, but again, it is really cool. Like your journey from going from PT to acupuncture is really cool, and it's. I mean, we spoke on the phone yesterday, and we spoke about it. Like, you don't really see that kind. Like, you can see a PT doing acupuncture as well, but you don't see that like total shift to acupuncture, which is really cool. And you get the best of both worlds.
I did my research on LinkedIn. I was like, I wonder how many PTs are also licensed acupuncturists. There's very few. There's probably like a handful or some, or 2 handfuls of us. To me, it was a career change. Something that I think I was kind of burned out from that 3x10 you know, that whole industry. And then even going off of like something totally different than what normal PTs do, like going to outpatient and whatever.
Yeah.
Just leaving that industry as a whole to find something that I'm still a physical therapist. I'm a physical therapist of the blood vessels and the nervous system. That's how I see myself now. So.
Yeah. And again, what a great, don't mind me, by the way. But that is, don't mind me, I said, hey. Hey, look at the wonderful art. Look at that little New York Metro card,
I love that.
right? It says, momentum. Direction is more important than speed.
I love that. I
Oh,
always
and
tell
wait,
my
wait.
patients that too. When we get gains, I said, let's keep the momentum going. Let's keep it going.
And speaking of things going,
Oh, God.
oh, no, it's not.
Well,
Oh
I'm so
God.
glad Darren's here to help us.
Well,
Oh,
now you're
Darren's
gonna
no help.
now you're gonna see. Oh, thank you. Now
I'm,
you're gonna
I'm,
see
I'm,
why.
I'm joking. I'm joking.
Now you're gonna see why I'm in different colors now. This is the part.
All right, are you all ready?
Hold on, I gotta
Oh
stand
my
up.
God, Darren, what is going on over there? Oh my
I'm
goodness.
so ready.
He
All right.
has like the special light change.
Well, that's Darren. It's our special guy.
Wow, that's impressive.
I'm waiting. This is the only part I have it for.
I
This
feel
is,
I feel like I'm
my
in a
favorite
music
part.
video.
Do you hear it? Do you hear it? Huh?
Oh, okay. Darren was like going, he's going on a jog. How long do we have to do this for?
5 minutes.
Keep going.
I'm gonna shut off the lights.
Oh, excellent.
He really bought the lights to distract everything. You look cool though. You look cool.
A little
Darren's the coolest guy
spaceship.
there is.
Yeah, you look like you were in a music video.
Yeah, that's why it comes with the job.
You never
I
know
love
if
it.
50 Cent asked him to join him in the music video for It's Your Birthday.
Ooh.
I'm
Love
joking.
it.
He did not.
Anyway, this was fun.
Oh,
I liked it.
see? Eileen, it wasn't that bad. It was
No.
pretty good.
I'm doing
Pretty
this again next week
okay.
with somebody else, so this was good. This is good practice. Good dry run.
Are you calling us a practice run?
Good practice run.
Did you just call us a practice run?
Absolutely.
Darren, could you believe this? Could you believe
I
this
cannot
nonsense?
believe, but it was a
God.
great conversation. I learned a lot. I think the stuff we talked about hit on a lot of great points. Everyone that's still listening, hope they kind of learn a little bit more. And yeah, I'm happy we
Absolutely.
did this.
Any final closing thoughts? Or any final closing questions?
Any final closing thoughts or questions? My
Well,
thought.
questions from the audience, thoughts
Well,
from
if
you.
anyone's any thoughts from me? If anyone's interested in learning more about acupuncture and my beliefs, I talk like exactly how I post and text and how I leave voicemails and blah, 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 blah. And how, if someone saw me in person, this is what you see is what you get. Please give me a follow. I'm at anew.acu. And I look
Hey,
for,
drop
I'm
it in
very
the comments.
engaging.
Drop it in the comments.
Oh, is that what people do? Okay, I'll drop it in the comments.
Oh my God.
I'm sorry.
Your grandma.
I'm a little, I don't know how, remember we did a dry run on the phone yesterday? Wait, but that that's me. And I'm also on TikTok. I don't
there
make
we
as
go.
good TikToks like Danny. I don't dance in them. So you see myself needling and myself or other people, and I'm open to like people asking questions and being interactive on TikTok. So anything you want to learn, anything more you want to know about acupuncture, fire away.
Yeah, Eileen is really cool. She's really great. I definitely would recommend if anyone has questions about acupuncture, wants to see more about what acupuncture is. She literally stabbed her arm. I know that's aggressive for putting a little
I thought it
acupuncture
was just
needle in.
every day. I thought it was an everyday thing. Is that weird? Guess that's
Okay,
weird.
we're gonna ignore that comment there. For people who want to see more, definitely follow her. She's wonderful. She's awesome. If only she was a little closer. If only she was a little closer. And then someone even asked, "Do you have a downtown Brooklyn location?" If only she was a little closer. And if I ever wanted to go for acupuncture, like this is who I would go to.
Thank you.
So, Dad, if you're watching, I'm sorry. I'm sorry.
Ouch.
Ouch is right. But yeah, Eileen is wonderful. So please, if anyone has any questions, DM her, comment on her stuff, look at what she's doing. She's doing a great job. And if anyone from your end is interested in physical therapy and what physical therapy means to you, or should mean to you, I totally butchered that. Whatever.
We got it.
Give a follow. Look at. I post a bunch of different stretches and exercises to help keep you moving free, and as if you're a dancer. Nice and limber, nice and fluid, and feeling great.
I love it. Lotion is motion. Or motion is lotion.
Oh, good. Lotion is motion. That's
we
the
can't
motion
cut that
lotion.
out of the live.
Nope, that's going right into the IGTV video that we're going to post as soon as
Okay, yeah, we're
it's
going to go for that. Anyway.
Eileen, it was such a pleasure to have you and speak with you and get to know more about you and what you do. And I hope that everyone enjoyed. We'll probably set up another thing, a part 2 to this craziness, this insanity, with better dance moves, even more information. Can you believe it? I can.
Love it.
Yeah.
People want to know. That's what I say.
Hey, people don't know what they want to know until they hear it. I can't tell you how many people have like went into a live or saw a post or read some kind of information. They're like, oh my God, I had no idea about this. I'm so happy I saw this.
Yeah.
Like you provided so much great information, so much valuable information that a lot of people need to hear, a lot of people need to know. And I'm very grateful and thankful for that, for this opportunity to have spoken with you and for you to have shared a lot of information and knowledge
Thank you, Danny.
to our audience.
And thank you, Darren.
I agree.
Of course.
You guys are amazing.
Hey, we try. We try to be amazing. The second this live is over, we're miserable. I'm joking. Joking. Totally joking. Positivity train all the way.
That's right.
So, if anybody has more questions, again, message Eileen. If anybody from your end has any questions about pain, physical therapy, what it means to be a good dancer. For the dancing questions, definitely contact Darren. He's our dancing apprentice. Yeah.
Awesome.
Darren, any final thoughts on your end?
No, this is, like I said, a great conversation, and I think we hit it all. So,
yeah. We three will get together in person soon, I swear.
Oh, yeah. Oh, that would be a crazy meetup. You know, all kinds of crazy things.
Yeah.
But all right, guys. Again, such a pleasure. Dinner time to eat some protein. And
all right.
Vegan protein, Eileen. Vegan protein.
Yes, sir.
We talked about that. For people who don't know, Eileen tried to be vegan. We spoke about that.
I try to be plant-based.
So all vegan up in here. Vegan up in here.
That's pretty impressive.
Yeah. I'm so vegan, I might just turn
grass-fed.
green.
I love it.
Yeah,
you're grass-fed.
Oh my God. I'm free range, grass-fed. Cage-free.
Use that tomorrow.
Organic.
Yeah, he's grass-fed.
Okay, well, enough of that. All right, guys, have a wonderful night. Thank you, everybody who is either watching this live or going to watch this as a post. You guys are awesome. We'll see you all on the Instagram dance floor or on Eileen's page where she pokes herself with needles. And the party continues. All right. Good night, everybody. Eileen, thank you. Darren, thank you. Good night and be well.
Bye.
Yeah.